everyone. Welcome back to Unhoused and Unfiltered, the greatest podcast in the world. I am loving it. We're getting so much positive energy coming towards it. Over 1,000 viewers. We've had hundreds of downloads. It is just makes me happy every time I get on this podcast. I am Nick Cook, Director of Public Policy for the Michigan Coalition Against Homelessness, and joined by
Rennie. And I love the energy, Nick, even though you startled me for a second.
yeah.
Is that
Well, you gotta
Go ahead.
we gotta bring it. We got to bring the energy. I think this is a great platform that we've been able to leverage and allow people to understand what homelessness means in Michigan and what housing affordability means and how it looks and where are we going with this? And the only reason we get to do this is because people get to like and subscribe and follow our podcast. And I know you always like to talk about the next piece.
Yep. Well, I want to say, first of all, like I said, I love the energy. Absolutely, this is an opportunity for us to talk about what's facing Michiganders, especially low-income Michiganders right now. And please consider joining Micah. We really need you. Your dues go directly to the work that Nick and I do. And you can join us at myhomeless.org. That's myhomeless.org. Please consider also the free thing you get to do is liking, subscribing this podcast. I am a nerd and I check where we are in the rankings. We're now number 10 of recommended homeless podcasts in the nation, and we're still in the top 100, which is very cool, but we still need your involvement, and please also share with your friends.
Yeah, it's just been a journey we've been on. This has been so much fun. But speaking of fun, I get to nerd out today. I know you get to nerd out. For those that don't know, my background's in civil engineering. I love math. I'm going to pass it over to you, Sarah, because I know you love this next guest we have coming up today.
Yes, I'm a huge data nerd. I love understanding sort of the patterns, both qualitative and quantitative data, and how we can use data to make the world a better place. And we are so lucky today to be able to talk about what data is, how it's important to the work, how we can track patterns of economics and homelessness for the unhoused population. And we need to know, sort of through our data conversations, how they come in contact with the COC, who are missing by the COC, I mean the homeless services. Basically, we need to use data to make better programs and to inform. And when we talk about data, we're talking about actual, verifiable, statistically proven data that we can back up. And we have a guest today who is a data scientist and expert. And we're going to have Nick go ahead and introduce him. I am so excited that we're talking about this important issue.
Well, and a lot of people have heard us spew off numbers and data and, how many people are homeless in Michigan, how many, what percentage of housing first works and what transitional housing, the success of that. And people are probably like, where are they getting this from? Are they just spouting it off? But we know this works, and that helps drive my advocacy and working with legislators on sound policy. So I'm real excited to introduce our Director of Data Initiatives, Gerry Leslie. Gerry, thank you for being here today. Why don't you take a moment and kind of introduce everybody to who you are and how you got here?
Hey, well, it's great to be joining both of you today on the podcast. I've been looking forward to having this opportunity for quite some time. My name is Gerry Leslie, and I am the Director of Data Initiatives at the Michigan Coalition Against Homelessness. And for those of you who may not be familiar with it, the Data Initiatives team at MICA covers the what's called the HMIS project. and that stands for the Homeless Management Information System Project. Every community across the country that receives any form of federal HUD funding in terms of, and I'll use these acronyms, we call them the HUD COC, but it's the Continuum of Care Program or the Emergency Solutions Grant Program from HUD federally, are required to collect data and put them into an HMIS system. So this is something that exists all across the country. And we in Michigan are very fortunate in that we have a statewide implementation or statewide homeless management system that we're able to pull from to understand what is happening with homelessness. My background comes from I have been working on the Michigan statewide project since 2007, which was 4 years after the project began itself in 2003. I started in a local community, started in Flint, Michigan. Made my way to MICA in 2012, and I have been the director of the data initiatives team, as it's now known, since 2016. So it's been a 10-year journey for me with a fabulous team. Of course, my own data initiatives team, and then the rest of the team at MICA are some of the most amazing people to work with. And what we do is we really try to take that data and use it in actionable ways to help people understand better what's happening with homelessness across the state.
Thank you, Gerry. And I want to follow up because I know you're kind of a humble guy, and I've had the pleasure to get to know you both in this job, and then I've known you, believe it or not, almost 20 years
Mm,
in other capacities when I worked with domestic violence. And I'd like you to talk to a little bit, because I know you're also a national leader, about
mm,
talking about data quality standards and
yes.
why this is important. So, two-part question. Tell us about how unique Michigan is to have a statewide program and why it's so important to have these data quality standards.
Yeah. So we are very rare in Michigan to have a statewide implementation. Statewide implementations of the size of Michigan, there is only one other state that I know of, which is in the realm of Michigan size, and that is going to be Minnesota. Georgia is in the ballpark. I don't know if Georgia's complete statewide implementation anymore. Most of the other statewide implementations are COCs that are approximately, or excuse me, are states that are in the 2 to 3 million range for population. Again, Michigan, we run right around 10 million people here in the state. So having that size of an implementation is very rare. And the big benefit of it and what is so important is over the past year or so, as Nick and Sarah have obviously shared many times on the podcast, is we have had to move very quickly in getting information in the hands of decision makers and legislative experts to make sure they understand what's happening in the bigger picture of homelessness. With a statewide system in Michigan, we are able to turn around data very quickly and get that in the hands of the people making the decisions. Now, if you look at other states across the country, Texas, large state, 29 million people or so, they have multiple implementations. California, which is running 40 million people, they're going through a multi-million-dollar project to build a data warehouse to pull all of the HMIS data from all of their COCs into one system. The problem with that is you end up with a delay on getting that information in place. And so with that delay, it leads to a delay in being able to get actionable information in the hands of the people that need it. With Michigan, we're very fortunate. We had last fall a number of things where we had high priority legislative discussions that were taking place, and we were able within 24 to 48 hours to get data requests over to the parties which needed it to share it with legislators. And that really helped to shift some of the dialogue and the discussion, knowing that we were able to provide that for them and assist with giving them the information to help with the decision-making process.
No, and Gerry, I appreciate that because there's a couple times where I had to call you, like, Gerry, I got about 24 hours to turn around some information, and it's been very helpful, especially when we dealt with some issues with criminalization. You provided some great information, um, you know, and like Sarah said, is you are kind of a national leader. We're very fortunate to have you. Um, I know you all talk. I know you guys share information back and forth. What states do you regularly interact with, and what data trends are you seeing that are similar to Michigan, or what other states are seeing similar to? Um, what's going on here. I mean, we talk about seniors and young people, but it would be great to hear that from the data scientist of the group.
Oh, yeah. So we regularly interact with, there's an organization called the Institute for Community Alliances, which is based out of Iowa. We speak with the Institute for Community Alliances, and they are one of the leading nationwide organizations which provides HMIS for about 10 different states across the country. They run implementations in Minnesota, in Wisconsin, implementations in Iowa, Missouri. We also regularly interact with partners in Virginia. We've had meetings with Texas, California, Arizona, as others. The big thing that we're seeing is right now we're actually seeing a reverse in Michigan of what we were seeing across the rest of the country in the last year. And then in the last year, we've seen homeless numbers decrease across the country. But in Michigan, we're actually seeing our numbers start to go up again here in the nation, here in the state of Michigan, which has been indicative to us that we do have an issue again with the potential growing homeless population. And again, the key thing about that is when you begin to see homeless numbers grow within the state, you want to make sure that we're introducing and funding programs which are effective in, number one, getting people housed, but then secondly, keeping them housed so that they don't return to homelessness. Because a lot of the macroeconomic factors outside of homelessness, those are things that we don't necessarily have the power to change from bigger economic perspective. But at the same time, we do have the ability through the design of our programs and the efficacy of the work that we do to make sure that we're doing the best possible job of coming up with solutions to house people and keep them housed, which ultimately will take them out of that moment of crisis and lead them on a path to self-sustainability.
Well, and that's an important point because this data is not just used for our homeless systems, right? It's
No.
my understanding that, and maybe you can talk a little bit more about this. We use this data statewide for things like Medicaid and
Mhm.
food stamps and all. It's a lot of development of other programs.
We do. And part of the thing is we have a great partnership with the Michigan Department of Health and Human Services, in which we have a data matching project that takes place. And within that, we're able to understand better what the intersection between homelessness and healthcare looks like, which is really critical because we know that people who experience homelessness have either a much more significant number of health issues which affect them, or if they have long-term disabling health conditions, what we know is that homelessness can exacerbate those conditions and make those much more problematic for people as they're going through that. So having the ability to bring data together and to understand better how addressing homelessness affects the bigger picture of those social determinants of health make a very critical step for us in being able to address somebody as a whole person and to be able to meet some of those needs. Now, one of the things that we've always looked at doing and we want to do, this is something that we would love to see in the future, is beginning to ask the question of if somebody experiences homelessness with a long-term medical condition, they're able to get housed. What does it look like in the longer-term picture for that individual as they find and maintain housing? Because that is going to be a critical step in addressing some of those needs. And we're already starting to see signs of the fact that healthcare needs reduce significantly when people are effectively housed in permanent solutions.
So that goes to my next question. Um, why do you think our listeners should care about your data? And it sounds like, to put in layman's terms, like why I care is not only do we want to help the person with the chronic health condition who's in homelessness, it also is a way of figuring out how much that person's additionally costing places like emergency rooms, or
Bingo.
and figuring out how we're kicking societal costs down the road or moving it around instead of actually getting a sense of how much, by not getting preventative care, somebody is, frostbite, for example,
Hmm.
is costing the systems. But can you talk about, if I were just tuning into this podcast, why should it matter that this is a statewide system rather than just like dealt with on an individual level?
One of the biggest reasons why is we're able to assemble that data and to do some very quick data development and data analysis based on that. And this is really critical because when you have multiple sources of data, you have two things that are going on. Number one, you have a challenge where you have to integrate data, and the data may be stored in very different ways. It may have different ways in which it is matched, and that adds a level of complexity to bringing all the data sources together. If you're running with a single system, like a single HMIS system, and all of the data is coming in the same way, it ensures that you're able to get that data and do evaluation on it in a much quicker manner. The second thing about it, why does it matter that we have a single statewide system? Honestly, it's a cost savings. If you look at the cost of each COC having their own system, and across the state of Michigan, we have, of course, 19 COCs now here in the state. The cost is approximately 2.5 to 3 times as much to have your own system and run it as it is to be part of a statewide implementation where you're sharing the cost. So that means more money can go into housing solutions for people, more money can go into case management, case services, and you can also have a degree of expertise at the focal point of the implementation where you can have a higher level of technical expertise on how to do this work instead of having to spread all of that expertise out across all the 19 COCs in the state of Michigan.
Uh, Gerry, I think it's been, just eye opening to me over the last year, getting to know you and getting to know your HMIS team or the data initiative. I like to call them the data initiative group as a former military.
Yes.
I like DIG as the acronym, but data initiatives team. Uh, you guys do amazing work, and you guys all really care about the homeless community, and you're always trying to figure out inventive ways to analyze the data. In a perfect world, what would you do with this data collection? What would you love to see this team develop into, and where would you like to see this data go?
I think the first thing that we would do in a perfect world would be to have an environment where we can do more extensive matching of healthcare and homeless data, in addition to things like criminal justice data, maybe veterans data in the long term, where we can begin to get a more holistic picture of what an individual in a household looks like. And we can begin to understand some of the factors which affect why people experience homelessness for longer lengths of time. And some of the early work that we've done, we've been able to identify several things which are, if you think about it, they're very obvious things, but from a data perspective, the data reinforces this. For example, if you are somebody who experiences homelessness in a very rural area, transportation to and from services and employment is a critical juncture to overcoming that episode of homelessness. And when there isn't good transportation, it provides a tremendous challenge on individuals. That's again something we saw from the work that we did in some of our own research. We also want to begin to ask questions. If somebody has cancer, if somebody has heart disease, if somebody has a liver condition or a physical disability, how does that affect their ability to access resources and take advantage of resources? And is there an opportunity to create more focused case plans, much like the education world does, to address some of the specific needs a household may have? And without having the multiple streams of data coming together to paint that complete picture of an individual, it's really hard to begin moving in that direction. And of course, that all begins with the ability to have a single shared statewide system whereby we have all the homeless data together from the start of the process.
Yeah, I love the idea. I mean, but everything costs money, and
Yes.
you know, um, you know, what what would what would something like that cost? I mean, I have no idea.
Yeah. Yeah.
What would something like that cost? What kind of investment would it be? And why would people care? So a guy's homeless, he has diabetes. What does that mean to me? Um, you know, I guess there would be some kind of cost savings there in the
Yeah.
long term as you make those connections. But, it, you know, one, is there a cost? But I guess the real question is there a cost benefit analysis
Mhm.
for this?
There absolutely is. One of the things the data has shown us is that the cost of a single emergency room visit for somebody experiencing homelessness is actually the same as what it would cost to house that individual for several months out of the year. So the idea of providing preventative services, keeping people out of homelessness, or if they do become homeless, getting them out of homelessness as quickly as possible, it is a cost savings to Medicaid. It's a cost savings to the government as a whole. It makes a big difference. It is to the point where health insurance companies across this nation are looking at if somebody who is one of their patients who they provide for, if they are able to provide supportive funding for keeping people housed, will that lead to better health outcomes, ultimately saving them money? And of course, that is something that I think every politician and everybody wants to hear is if we can come up with solutions that save people money, that's really critical. Now, again, the reason why that is with somebody experiencing diabetes is because somebody with a diabetic condition is going to have a experiencing homelessness, likely many interactions with the health care system because of the nature of their condition. And having somebody in housing and treating that diabetic condition is going to be much more cost effective than it would be trying to treat that while somebody's in a shelter or out on the streets. Now, when it comes to cost, for instance, for our system, it currently is running us about $1.3 million to continue to have the system run on an annual basis. We are in the process of something called a campaign that is named HMIS Reimagined. And the idea behind that campaign is we're coming up with a new future funding way to ensure that HMIS is sustained long term, especially with some of the funding cuts we currently see happening across the state and across the country. So HMIS Reimagine is going to come up with a way to create some sustainable funding to ensure that the project is able to continue moving forward into the next couple of years and beyond. But beyond that, we want to expand our data analytic capability so we can, one of the big things we want to do is we want to be able to provide a dashboard which is giving the public, giving legislators, giving local community leaders the information about homelessness across the state of Michigan in a very democratic and public way. We called this campaign the Democratization of Data campaign, and we really believe that keeping a flashlight on the work that is happening within homelessness is the best way to provide that transparency, number one, on the work that all of our communities are doing. But then secondly, also provide us with an opportunity to make the cases for what works because people can see the data. And then obviously, if there are things that are not working, we can make changes to those programs which improve outcomes. And that ultimately, at the end of the day, what all of us are here for is to ensure that everybody in Michigan has a safe and affordable place to live, and they're able to sustain that housing. And that's ultimately the goal that every one of us has in the work that we do.
That's awesome. And I really liked what you said about shining a light because there has been some misinformation out
Yes.
into the out there in the ether about what works and what doesn't. I do want to follow up on a couple quick questions. It's my understanding because if I was out there, I'd be like, you're tracking people in an aggregate, like the individual
Yes.
um, who comes to you for help. That's not something that's shared on a database or
Correct.
anything. That
Correct.
belongs to the individual. If I were in a local community, what else, in addition to the, you can go seek help. We're gonna calculate your data in a total part of a whole
Yeah.
thousands of records. What else in local community folks should they know? And should folks in communities know? What should listener know? And where can they go to find out more?
Obviously, the big places you can go to find out more is we have the Campaign to End Homelessness website, which is, I think, the campaign to end homelessness.org. And correct me if I'm wrong, please, but that is where we have a lot of the information, including the annual reports that do come out. Obviously, in Micah and social media, we do provide a lot of data that comes directly from the HMIS and from some of our other federal partners. And you can even go to HUD and some of the release of data that they have themselves to begin to see that. Now, again, Sarah, one of the things you referenced was the fact that we are able able to provide that data. And one of the most powerful data points for the last 6 to 8 months that we've seen is when we talk about permanent housing solutions. So, for example, permanent supportive housing, which is housing designed for people with disabilities and higher level needs. We see success rates in that program across Michigan about a rate of 96%. People who are in what's called rapid rehousing, which is a time limited permanent housing solution, which is designed to provide things like first month's rent and payment assistance, and then over time taper it off as individuals are able to sustain their own housing. We see, and this is the thing that blew me away when I saw the data, but we're seeing that successful at a rate of about 90%, which means 9 out of 10 households in Michigan that take advantage of rapid housing services are successful. So permanent housing works. And in the state of Michigan, we've seen these numbers for the last couple of years that they've remained consistently high between the range of about 88 to 90% for rapid housing and about 93 to 96% for permanent supportive housing.
And just for our listeners, they're for two different populations, right? Like permanent
Yes,
supportive housing are folks with severe disabilities, mental
correct.
health, significant mental health issues. Um, it's essentially folks in our communities who need more help. And
Yes,
then rapid rehousing is for those folks that had that one bad day, maybe, lost their job or had a major illness. And it's designed to help people get back on their feet.
correct.
And I think it's really important that we're clear that that works because there certainly has been a lot of like the Cicero Institute and places who are saying that it does not. And I think part of what you'd show is that the data is really specific, right? You have to
Yes,
know
yes.
what you're asking to be able to say what works and what doesn't.
Mhm. And for instance, one of the things we see in our numbers in Michigan is, and again, some of this can be underreported. We are aware of that, but when we look at the number of individuals, and this is where it came out of the Cicero Institute and some of the other publications, but where they were talking about people experiencing some form of substance use disorder as part of this, we see in the Michigan data that only about 5% of the population in the state of Michigan who experiences homelessness has some form of substance use disorder. It is much lower than what some of the information coming out around the country might suggest. The big thing that we do see, and this is, I think, really important for the advocacy work that we're all doing. And I know Nick and Sarah, you're just doing a wonderful job with this, but mental health is the most common disability, and mental health disabilities for individuals are higher than the next two forms of disability combined. So making sure that we're continuing to provide support for people who experience mental health conditions, providing the proper health care and housing solutions for them is really critical because that is by far and away the number one disability people experience when they're experiencing homelessness.
Well, Gerry, I really want to thank you so much for your time today. I know you could sit here all day and go through data points with us and how the HMIS system works, and you are a wealth of knowledge, and we're very lucky to have you as part of the MICA team. Your data initiatives team does amazing work every day, and they keep the data flowing.
Mhm.
They provide all the technical support to the COCs. They make sure that data is viable and usable. And I really appreciate your team, especially when I call and say, "Hey, Gerry, I need to know how many unhoused people are in this area." And you're like, "Nick, well, depends."
Yeah, that's right.
And you're like, you walk me through it. So, thank you for over the last year just being an asset to our team.
Yeah.
And keep doing the great work, and look forward to seeing what happens with HMIS Reimagined and the
Mhm.
democratization of data. So thank you,
Yeah.
Gerry.
Thank you.
Thank you. Gerry is absolutely amazing. I it really enjoy his just how he frames things. And it's wild, don't you think, Nick, that we hear so much about people being on drugs or using drugs, and it's not really the driver of homelessness that everyone thinks it is. The other thing I just really want to make sure folks know is he's only one side of the equation for reasons back in the 90s about confidentiality. Domestic violence data was separated from homeless data. And so about 20% of folks who are homeless are also domestic violence victims and are being served by domestic violence shelters, and those don't get counted in the domestic violence or in the HMIS system. So it's really, again, important we have someone who can take these two different sources and be a data scientist and sort of paint a picture for us.
Yeah, when I first started working at Micah, I had no clue. I just assumed if you were homeless, whether you were domestic violence uh, survivor or if you just were unhoused for losing your job. I thought it was all the same data, and for good reasons, it's been siloed. But without somebody like um, Gerry, you're only seeing homelessness through one lens. You're not seeing the total picture. Um, you know, and so we're very fortunate to have Gerry on our team. And then each community um, owns this data. Each COC owns this data, and they each have somebody that really dives into their data and knows their data and how it works. So we're fortunate across the board.
That's awesome.
Um, Yeah, so we have a lot going on.
We certainly
You
do.
know, and on some good news, what's going on with the 25 NoFo
Yeah,
lawsuit?
so that is great news, actually. We, as part of the whole collective we, as most of our listeners know, there's been litigation against HUD against the 25 notice of funding opportunity. There was some wild things in there that were just sort of were unconstitutional, and the government didn't follow what they were required to do in terms of process. So a federal court has struck down the 25 NoFo. Essentially, we won. For those of you who are members of MICA, that is partly because of your work. If you're not, come join our party because we are, when we fight, we win. But the other thing we need to do now is we're now in 26, that NoFo or that notice of funding opportunity. And again, this is how the money gets to the states, has some new and continuing provisions that are going to have to be litigated that we believe are unconstitutional and violate state and federal law. So a new
So wait, wait,
lawsuit
wait.
was filed.
So
So
so we're
we
going.
won, but now we have to file a new one.
So we're going through this again.
Pretty much.
Is what you're
Yeah.
telling me. So,
Yeah.
for the people out there that are listening, the notice of funding opportunity that comes out every year from HUD is the largest funder of the homelessness response system in the state of Michigan. It's about $108 million annually, and you're saying we won in FY 25,
Yep.
and we're doing this again. So,
It was everyone's hope that HUD would not mm, do the same things in this year, but they have. It'll be hopefully a easier litigation because we've already had one, right? Unfortunately, the court didn't reach some of the underlying legal issues in the 25 because that NoFo was issued in such a way that was too quick and didn't follow any process. So we didn't have to reach the legal unconstitutional issues. This time we're going to have to litigate some of the provisions that we think are unconstitutional. And amongst that is not to get too technical, but the federal government, it's funny that we're being states' rights folks, but the federal government only has so much power to tell the states what to do. And it is trying to use this notice of funding opportunity to tell the state how it should deal with its homeless residents, which is going to be a separation of powers issues for states' rights. And so that's going to be a significant issue, as is the use of what is essentially just a vehicle to get money to the states as a way to try to change federal policy. That's really a congressional role. So there's a lot of uh, HUD simply overstepping its role, and that will all have to be litigated again.
Yeah, and what Sarah's referring to is a lot of the criminalization of homelessness, changing how you categorically house individuals, um, you know, which also violates the Hearth Act and some other congressional, um, you know,
Changing the
laws that are out
definition
there.
of disability violates a long line of Supreme Court cases. There's been a move to eliminate HIV and mental health, not explicitly, it was sort of in how they scored it. So it's going to be a question of whether that scoring can weight some disabilities differently than others. Overall, it's a bad policy, and I'll let you talk about that because we have never said if you're, very, very ill from HIV or you're wheelchair, a wheelchair user, we've never tried to make a comparison over which of those folks need housing. And our folks on the ground don't need to be making that decision either. Those folks are both severely disabled and probably and meet the definition of disability. So that is going to be a huge issue to be litigated. And it's puts a lot of pressure on our programs because they don't really know what's going to happen.
Yeah, and I think that is kind of the crux of the problem is this NOFO goes out. Um, the COCs are having their competition. They're supposed to have their results by the end of July. They put it together. They send it to HUD for HUD's approval and their scoring to then um, send out the money to the locals. And it puts everything into flux. And I think and I know the National Alliance to End Homelessness, the National Low Income Housing Coalition, Democracy Forward, they're all working in concert together. And I know NAEH is really pushing on Congress to put in language in the FY27 Transportation and Housing and Urban Development appropriations budget to allow renewals while this litigation goes forward because of the unknowns that are out there, I guess would be the best way to put that.
The unknown unknowns, to quote somebody. Yes, absolutely. And I want to emphasize because I know there are people who have asked me, well, elections have consequences. So doesn't the federal government get to change policy? And they do. But we have basic federalism for a reason. We have Congress gets to change and write the policy. The executive branch then gets to do the will of Congress when it comes to money. And so I think it's really important that these are not things that we take lightly. Um, we believe in, the rule of law, and part of that is making sure that each branch is doing its job and not overstepping into the other branch of government.
Yeah, and we know Gerry just talked about it. We know homelessness is increasing in Michigan. We know there's a housing shortage in Michigan, which this is starting to be kind of a theme coming out of Washington that low income and unhoused people are others. We're not worried about them. The president, Congress overwhelmingly passed the 21st Century Road to Housing Act a couple weeks ago. The president famously canceled the bill signing. We are waiting to see if it actually becomes law. If he signs it, if he doesn't sign it and Congress doesn't go into recess, it automatically becomes law after 10 days, or does he veto it?
But he's
These are all
sending a
questions.
message either
Yeah,
way. Like by not signing it, he's sending a message about it's a conversation about economic justice and affordability and the idea that we're not having affordability issues, not just for folks who are homeless, but folks who are struggling to make ends meet. And in terms of policy, not law, there is definitely a signal from um, the federal government that there is a lack of concern about folks who are working paycheck to paycheck.
Yeah, and this 21st road to century or 21st century road to housing bill, I mean, is years of work by Congress to come together and do everything from changes to finance to financing of multifamily dwellings to changes in veterans on their disability, allowing them to qualify for VASH vouchers. Currently, right now, a veteran's disability can disallow them from qualifying for VASH. So
You
this
know,
is
it's great you brought
bipartisan
that up
work.
because yes, this is bipartisan. And when Gerry was talking about disability being one of the drivers of homelessness, the first thing I thought about was our conversation about PTSD. I think people always, and there is no shame to have other complex mental health issues, but I think we ignore the fact that PTSD is one of the significant issues facing veterans.
Yeah, you're exactly right. You know, it goes not only is it veterans, but then you look at um, LGBTQ and women that are survivors of domestic violence. I mean, PTSD is real. And, you know, it really is unfortunate that we are, I guess, saying other disabilities are better or worse off than other disabilities. But as you say, the courts have weighed in on this, so we'll continue to see how this plays out. You know, I
Yeah,
just,
traditionally we don't get to do that.
yeah,
There's a standard of what disability means in terms of your ability to work. We don't then say um, diabetes is worse than, cancer, or depending on how severe the person's suffering from either, right? Because it's an individual situation. My mother-in-law worked during her breast cancer. I've seen people who are, unable to function with diabetes. You don't know. You have to meet the legal standard. So,
yeah,
not to nerd out, but
yeah,
it is a matter I'm very passionate about because I think um saying someone is disabled, and they've even changed the language back to handicapped, is another way to sort of say they're bad or should have involuntary their rights taken away. And many of us live with people with disabilities or love people with disabilities, and you know those folks are our community.
yeah. And I don't think anybody wants any of our listeners want to go back to involuntary commitment.
Or
I,
calling everyone handicapped. Yeah.
Yes. You know, but you know, thank you so much for explaining this all to me. You know, I try to make sense. I try to make sense of this when I'm reading, but I'm not a lawyer. So I really appreciate your insights into this. And I hope our listeners like and subscribe our podcast. Go to wherever you listen to your podcast, Spotify, you know, iPad, I always
iPad.
say iTunes. But you know, Apple Podcasts, you know, even YouTube. Watch us, listen, like, subscribe, comment. Let us know how we're doing, what you want to hear about. We would love to talk about it. And I know your favorite thing to do. I'm going to hand it over to you, Sarah.
Yep. Please like and subscribe, share, but also become a member of MICA. We're at myhomeless.org, and you can become an individual member or an agency member or a corporate member. And not only does that get you more access to Nick and I, but it also helps fund the work that we do.
And I just want to thank everybody. Thanks to Gerry and his team for everything they do. Thank you, Sarah, for explaining everything to us as you always do, very concisely. And you know, I'm excited uh, to to go into our next podcast and just see where things keep going. So thank you again. This has been a great conversation.
Thank you.